All right, welcome back to the deep dive. Today we're tackling RMADA 3.
Sounds daunting.
It can be, right? Especially if you're trying to figure out like what kind of expertise you need to really make a mark in these Medicare and Medicaid research projects.
Oh, yeah, definitely.
Luckily, attachment J.5 kind of spells it all out.
It does.
It's like almost like a blueprint for building like the ultimate research dream team.
Yeah, it really is fascinating how this document, you think it's going to be just like a dry list of skills.
Right.
But it really, it gives you a glimpse into just how complex this whole world of healthcare research and policy really is.
Absolutely.
We're talking about, assembling this dream team to tackle some of the biggest challenges facing Medicare and Medicaid. And it takes a village.
Yeah, that's a great way to put it. A dream team, huh? I like that. So who are these like key players that we need to think about?
Well, the document highlights a huge range of expertise. And I mean, you're talking everybody from economists, actuaries, statisticians. Those are the number crunchers.
Right.
But you also need the folks on the ground, right? The physicians, the pharmacists, the people who are actually interacting with patients day in and day out.
Got it.
So it's truly multidisciplinary.
That makes total sense, right? You need the people who can see the big picture data, but also the folks who are living that reality every day.
Exactly.
So let's dive into some of those skills. Like, where do we even start? The document lists its research methods and design first, which seems pretty straightforward, but is it really?
Yeah, it sounds basic, but we're not talking about, just whipping up a quick survey here.
Right.
The document specifically calls for high-quality, complex, multi-site research.
Okay.
And that means we're talking large-scale studies, potentially across different states.
Uh-huh.
So the coordination involved is immense.
Okay. So for those of us who, like, aren't researchers, what does multi-site research really involve? What makes it so complex?
Well, imagine trying to collect data from a small rural hospital in, like, Montana, and then trying to compare that to, like, a massive urban hospital in New York City.
Right.
You've got totally different patient populations, different healthcare systems, even just different ways of collecting the data in the first place.
Uh-huh.
So you're talking about standardizing procedures, managing these like diverse teams across all these different locations. And then you've got to make sure that the data is comparable across all those different sites.
Yeah, that sounds like a logistical nightmare.
It can be, yeah.
Okay. So then there's this whole idea of primary data collection, which I think a lot of people are familiar with. Surveys, focus groups, that kind of thing.
Right.
But then there's this phrase, environmental scans, that really caught my eye. It sounds like almost detective-like.
It's a great analogy.
Yeah.
Environmental scans are all about understanding the context, right? Like what's going on around healthcare? What are the social, the economic, even the political factors that might be influencing these programs?
Right.
So for instance, maybe these scans uncover this huge trend towards telehealth in rural areas.
Okay.
Well, that could completely change how RMADA 3 approaches its research on access to care.
So you're not just looking at the numbers, you're looking at the whole world around those numbers.
Exactly. You're connecting the dots.
Okay. Makes sense. And then, of course, we can't forget about the data itself.
Right.
Secondary data collection, the document mentions, involves using Medicare and Medicaid claims data.
Yeah.
And I've heard that stuff can be a real bear to work with.
It's notoriously complex.
What kind of challenges does that present to this, like, dream team that we're building?
Well, claims data, I mean, it's a goldmine, don't get me wrong. It's packed with information.
Okay.
But it's messy. You really need that specialized knowledge to be able to sift through it and make sense of it.
Uh-huh.
So this team has got to understand the ins and outs of billing codes. They need to be able to spot potential biases in the data, and they need to figure out what the data is not telling us. It's not just about the analysis. It's about critical thinking. It's about asking the right questions.
It sounds like you need a healthy dose of skepticism along with those analytical skills.
Absolutely.
Data analysis is just one piece of the puzzle, though, right?
Right.
The document also emphasizes subject matter expertise, which sounds pretty broad.
It is broad, but it is absolutely essential. It's almost like having a GPS, right, for navigating the crazy world of Medicare and Medicaid.
Okay.
You could be the most brilliant data analyst in the world.
Uh-huh.
But if you don't understand the nuances of CMS policies, regulations, how these programs actually work in practice,
Yeah.
your research is not going to have that real-world impact.
So it's like you got to know the rules of the game before you can start playing.
Exactly. You can't just jump in blind.
Got it. And speaking of making things clear, the document also stresses communication skills. And they list things like reports, presentations, even developing training materials.
Right, because it's one thing to do the research. It's another thing entirely to be able to communicate those findings in a way that policymakers, healthcare providers, even the general public can understand and then actually act on.
Yeah.
So it's about bridging that gap between the research and real-world change.
That's a great point. You could have the most groundbreaking findings in the world,
Right.
but if you can't explain them in a way that people get, what's the point?
Exactly. It's all for nothing.
All right, last but not least, we've got learning networks. I got to admit, this one sounds a little bit academic to me.
It does sound academic, but it's actually a very forward-thinking concept.
Okay.
Learning networks are all about continuous improvement.
Uh-huh.
Sharing best practices, making sure that everyone involved in RMADA 3 is collaborating and learning from each other. It's about creating this community of experts who are all dedicated to, making Medicare and Medicaid better.
So it's about making sure everyone's on the same page and they're constantly learning from each other's experiences.
Exactly. It's a very collaborative approach.
That's really cool. Wow, this dream team sounds like they need to be like a powerhouse of skills and knowledge.
Oh, they absolutely do. And keep in mind, this is just a high-level overview.
Right.
Each specific TAG order within RMADA 3 is probably going to require even more specialized skills and expertise.
So if you're listening out there and you want to be a part of this whole RMADA 3 world, what advice would you give them? What kind of impact do you think RMADA 3 could have on the future of healthcare?
Well, that's the million-dollar question, isn't it?
It is.
RMADA 3 has the potential to really shape the future of Medicare and Medicaid. I mean, we're talking about programs that affect millions and millions of people.
Yeah.
So if you're passionate about healthcare research, if you want to make a real difference, this is an incredibly exciting area to be involved in.
Absolutely. Well, thanks for this really insightful deep dive.
My pleasure.
Until next time, keep diving.